All right, so my name is Nathan Lloyd, and I have nothing to disclose.
And my name is Bradley Osemwengie. I have nothing to disclose.
We're second-year medical students at Texas Tech. We've been doing research with Dr. Ansari, and we're going to present on a case of carotid artery stenting in a type 3 aortic arch. Dr. Argueta was our mentor in putting together this case. So this is our abstract. We'll just move past that. But before we go on to this, just wanted to preface this by saying that in our particular region, management of type 3 aortic arch can be challenging. In accessing the internal carotid via the type 3 aortic arch is often challenging for the interventionalists. So we'll be presenting on a novel method to facilitate that access.
So on to the case. So we have an 87-year-old female who presented with symptoms of a transient ischemic attack. She had a past medical history of hypertension and diabetes. And whenever she came in upon further investigation, it was discovered that she had 50% stenosis in her right internal carotid artery and then 80% stenosis in her left internal carotid artery. She was turned down for carotid endarterectomy by the vascular surgeons, and so she was referred to the interventional cardiology team at Texas Tech for further treatment.
So the first thing that the interventionalist did in her workup was the carotid artery Doppler, and you can see the turbulent flow consistent with carotid artery stenosis. They then followed that up with an angiogram, and in the first part of the angiogram, you can appreciate the type 3 aortic arch. And here you can appreciate the lesion. Despite the complexity of her anatomy, it was decided nevertheless to proceed with carotid artery stenting. So a glide wire advantage, no torque, Judkins right, 6 French, was used to engage the LICA, and the shuttle sheath was exchanged over it and into position in the left common carotid. In order to facilitate that particular entry of the shuttle sheath, prior to inserting the shuttle sheath, it was bent into shape using the bent shuttle sheath technique by Dr. Ansari, using this dual temperature heating gun. And this is inside the patient, but that shows roughly the shape that the shuttle sheath was bent into prior to entry.
And so the MOMO device is usually used for these types of procedures, but because it was a type 3 aortic arch, we decided to go ahead and use the EmboShield nav filter. And so the EmboShield nav filter was advanced past the lesion for embolic protection. And this kind of shows the blood flow. You can see the occlusion as well as the filter being deployed. This is before intervention. The stent was then engaged and deployed as depicted here. You can see that the stent is being deployed and the shuttle sheath is kind of helping support this process. So stent deployment. And then this is an angiogram post deployment of the stent with the nav filter still in place and then the nav filter removed.
And here we have our before and after. You can appreciate the improved blood flow after the procedure. And this is an image showing or a video showing the same thing. And so our main take-home point here is even when surgeons or when operators are a little less experienced, they can still navigate this complex aortic arch anatomy in some select patients. Thank you for your time.
Any questions? Any comments? That's a good case. You know, these complex arches are very well attacked radially sometimes, just the way the anatomy is. So a right radial approach, you know, is certainly doable. You actually like those in complex arches. I think it's, you know, it's nice the way you shape the catheter and got up there and that image. Sometimes you can just overcome all of that by just going radial. You know, I agree. The MOMA tracks fairly well. You don't have to use a MOMA for all your carotids by any means. Most people don't, I would say. But it does track fairly well. You may have been able to get it out there.
So for all the carotids, I prefer mine. I use one
I
because it
agree.
gives both proximal and distal protection. But the type 3 aortic arch, no matter what wire we select, it always gives us trouble in the end. And if we're stuck, we're stuck. Going to the radial is a good option, but in old, short ladies with the tortuous radial, it's also very troubling. So that's when we said, okay, we use this for our ASDs and PFO to do the same technique. Might as well try this for the carotid, and it works really well. So you use a heating gun, you put it in such a manner that it tracks so really well, and once the shuttle sheet is there, then the procedure becomes very simple to do. The support is just incredible.
That's a nice job.
Thank you.